Welcome back. Did you know that epilepsy is the fourth most common neurological disorder? Now, despite its prevalence, the condition is still widely misunderstood. This morning, to help us separate some of the facts from fiction, is Dr. Tiffany Eady. She is a neurologist from Ochsner Baptist, and she is here right in time for National Epilepsy Awareness Month, which is all November long. Dr. Eady, welcome to the show.
Thank you so much for having me. It's my pleasure
Thank
to be here.
Thanks so much for coming on, and I'm glad that we're going to be dispelling some of these facts from fiction. But before we talk about the fiction, the myths, tell me, what is epilepsy? Because I always wonder, is it something you acquire, or is this something that people are born with?
That's a really great question. Epilepsy just means that you have a likelihood to have seizures. And so if you have seizures spontaneously without any kind of provoking event, if you just have seizures kind of in your normal everyday life and that's something that you struggle with, if you have two or more of those seizures, then you have epilepsy. Now, people who have seizures in the setting of an acute injury, when they've just had an accident, or if they have some other critical illness, they don't necessarily have epilepsy. But for people who have seizures that need medication and have more than two in their life, they have the diagnosis of epilepsy. It's a very general term.
Fascinating. So I know a lot of people don't understand epilepsy. Sometimes they confuse it with seizures, and that's not necessarily the case. Let's debunk some of these myths. Here's our first one right here. It says, everyone who has a seizure has epilepsy. That right there is a myth. Tell us what the fact is.
Yeah, so the fact is that seizures are sort of the common pathway with any sort of brain injury. So if you have a brain injury, you can have a seizure. That does not mean that you have epilepsy. If you have a critical illness or one of your organs isn't right, working correctly, you can have a seizure. That does not mean that you have epilepsy. People who have epilepsy have seizures even if everything else in their body is working correctly.
Very fascinating. Now, this next myth here is one I'm very, very interested in. Every seizure is the same. False. Tell us what the fact is.
Yeah, so the fact is that seizures come in all sorts of varieties. You can have seizures where people just stop talking and interacting. You can have seizures where people have very abnormal but small movements. You can even have seizures where somebody is completely interactive and they can talk and have a conversation with you, but they smell an odd smell or they hear an odd sound. And then there are the seizures that we're more familiar with because we see them on TV, and those are the big shaking events. Um, those those are one type of many types of seizures. What is interesting though is that when it comes to seizures, even though they can vary widely between people, the same person generally has the same seizure type over and over. It usually looks the same.
Fascinating. Now, this next one is something I learned in school. Here's the myth right here. You can swallow your tongue during a seizure. That is a myth, but you are supposed to turn them on their side, right, if they are having a seizure.
Absolutely. Yeah. So, a couple decades ago, that was the recommendation. We asked people, hey, make sure you don't swallow your tongue. Well, people do not swallow their tongue. That is just not a thing. And so, what ended up happening was that all these loved ones, these family and friend, would go and try to get the tongue and end up getting bitten and getting injured themselves during a seizure. So, you definitely don't want to go in a patient's mouth when they're having a seizure, but you do want to turn them on their side. And that's because after seizures and during, at times, people can actually vomit a little bit, and it's unsafe to have them laying on their back because they could choke on it. So you want to turn them on their side. So anything that happens, they're safe and their airway stays nice and open and they're able to breathe. But please do not go in their mouth.
Fascinating information there. And I know another myth that we want to talk about is that epilepsy cannot be cured. It is a myth, but I do want to ask you, what are some of the treatment options for people who have epilepsy?
Yeah, so epilepsy, our major goal is to reduce seizure burden. Seizures are, they can be very unpredictable and they can cause a lot of disruption in people's lives. And so the first thing that we always start with is lifestyle changes and medications. And frequently, we can actually get a person's seizures under control just with medications. And so you have to take your medicines every day. You can't miss any doses. But for certain amount of people, um, with the first medication, about half of the people are well treated, and then some people need a little work with medications. But overall, about 2/3 of people can be well treated with medications for epilepsy. If people
Fascinating.
if people don't if their seizures don't go away with medications, and we have 30 plus medications that we can try, if their seizures don't go away, well, then we start talking about other procedures that we can do, and there's a wide variety. There's
Yeah, you're seeing them
different.
right there. Dr.
Yeah,
Edie,
that's
I would
right.
love to talk to you some more, but we are out of time. If you want more information about epilepsy and the available treatments, just log on to ochsner.org/epilepsy or give them a call at 504-842-3980.